but also living conditions.
Yeah, it is right.
Yeah. Okay.
Hello, everyone. A warm welcome to all of you. I'm Suchishmita, a lung cancer survivor and Associate Communication Manager here at Lung Connect India Foundation. It is both a personal and a professional privilege for me to moderate today's session on World Cancer Day, a day that reminds us that cancer care and prevention must be people centered, inclusive, and forward looking. When we speak about lung cancer, the conversation often stops at smoking, but today's discussion goes beyond that narrative. We are here to talk about something we all share. The air we breathe, and how climate change and deteriorating air quality are silently increasing lung cancer risk, even among people who have never smoked. Climate change is no longer a distant environmental concern, it's a public health reality, and its impact on lung health, lung cancer, is becoming impossible to ignore. Today's session aims to bridge science, clinical insights, policies, and lived experience to better understand this growing challenge. It's my pleasure to introduce our distinguished panel for today's discussion. We are joined by global national experts who bring diverse perspectives from oncology to research, policy, and patient advocacy. Uh, I will start with Dr. Urvashi Prasad, an eminent patient advocate from India with a lived experience of lung cancer. We also have Dr. Ken Kiboashi. He is an eminent oncologist based in the US. He is a leading expert in lung cancer research and member of OUCH International, an organization based on climate change and its effect on cancer diagnosis. We will also be joined by Dr. Yannick Romero. Dr. Yannick he is a researcher in UICC. He is a strong patient advocacy voice and a driving force in raising concerns about lung cancer worldwide. We have Dr. Tanya Lal. She is a caregiver and a patient advocate. We will also have Dr. Akhil Kapoor, who is professor and medical oncologist at MPMMCC Varanasi, India. Dr. Nandini Menon, professor and medical oncologist at Tata Memorial Hospital, Mumbai, and Dr. Rishabh Kothari, medical oncologist, director at Oncoven Cancer Center, Ahmedabad. As we all know, the theme for World Cancer Day is patient centered care. So, would like to start today's discussion with Dr. Urvashi. Dr. Urvashi, as someone who is a non smoker and has been living with lung cancer, what are your views about the changing air quality and environmental conditions presently in India?
Thank you firstly for having me here. And it's a pleasure always to uh, associate with Lung Connect and its activities. I think this topic is so pertinent, and we've been talking about it here in India a lot, but I think not enough action as much as I would have liked to see. We just had our union budget come out on the 1st of February, and there have actually been cuts in that with respect to fighting air pollution. So that was not very encouraging. But I think the evidence of the impact is pretty clear. Of course, now we also have research from across the world, but I think moving beyond research, the real life experience of people like me who have been non-smokers and who have, never had any major lifestyle issues, that would have contributed to something like this, and that to being, diagnosed at stage 4 right away. So I think, of course, research is underway, but I think even if you ask oncologists, they say that they've seen such a shift in the profile of people with lung cancer. Earlier, they would mostly see smokers amongst their patients, but now they see an overwhelming number of non-smokers coming to their OPDs. And also, a lot of these people happen to be young people. I was myself diagnosed at just 35 years of age, but I know people much younger than me as well who have been diagnosed with ALK positive lung cancer and other oncogene driven non-small cell lung cancers. So they're seeing many more young people, they're seeing many more young women. There's certainly a gender dimension to this from what we can see, especially with these oncogene driven lung cancers. So I think air pollution, is already having a serious impact. The impact is only going to grow in the time to come. And it's not that we don't know the solutions altogether, but we need a collective will at the highest levels, political levels, government, everybody needs to really step up because air is something so fundamental. No matter how much anybody can protect themselves, and the affluent certainly can with, whatever air purifiers or things that they can do, but that's really just masking the problem, in bits and pieces and not really solving it fully. So I hope that we will find this collective will to really tackle this issue in a very strong manner.
Thank you so much, Dr. Urvashi. Ma'am, mic is off.
Yeah, no, sorry, I wasn't. I
Okay.
think my screen just froze for a while, but yeah, I think I
Yes.
said what I had. Yeah.
Okay. Thank you so much, Dr. Urvashi. Moving to Dr. Ken, as someone who is a global expert in climate change and cancer. So, Dr. Ken, in your opinion, how does climate change worsen air quality and what is its direct effect in causing lung cancer?
Well, first of all, thank you for inviting me. I've been very impressed with the work that Lung Connect and especially Lung Connect India has been doing, and it's a great pleasure to be able to speak to you today. Second, just a matter of transparency, I'm here really in my capacity representing Ouch, and not so much as a global cancer expert. I don't have pretensions to that to such a sterling label personally. I think that, well, look, we know that air pollution is a cause of lung cancer. That's been proven multiple times. Mechanistically, we know that one of the key elements of that is that pathogenetic cycle is mediated through fine particulate matter, PM 2.5, and PM10 as well. PM 2.5 is very dangerous, not only because it can penetrate into all manner of tissues through the blood vessels because they're small, and stimulate inflammation and cause other cellular and genetic changes, but also because other environmental carcinogens will stick to the particles. And so the particles carry not only the physical, physically damaging agent, but also they're transporting other chemical passengers. So air pollution is a particularly nasty mix of these fine particulate matter particles, nitrogen oxide, sulfur dioxide, ozone, so on and on and on, polycyclic aromatic hydrocarbons, and is this mix that is becoming very prevalent around us. There's, as Dr. Prasad has mentioned, this is a global problem. It's no longer, people can't hide from this. But within that, we do know that there are distinct gradients. So living in close proximity to, for instance, oil depots, fuel processing plants, oil extraction wells carries a graded risk of multiple cancers, the most recently documented, which is childhood ALL. The closer you get, the higher the risk. So the air pollution in itself has a direct effect. In addition, there is a much more insidious indirect effect in that air pollution is a major cause of global warming, right? We're all aware of that. We recently had the COP30 in Brazil, which had less than stellar results. But as a result of that, we all are aware of the impact of global warming. That in and of itself, the extreme heat stress is also an important mediator of increased mortality. So we were just talking before this meeting started that in northern India, the temperatures can get extremely high, 40, I think it was 40 up to 40, 45 degrees. And of course, in southern India, this problem is much greater. We also know that prolonged exposure to extreme temperatures, so more than 4 days exposure to an extreme heat wave, will cause increased mortality in newly diagnosed patients with multiple myeloma. So at every level, from the extreme weather disasters that we've all heard about, that where the dangers and effects on cancer patients are clear and obvious, to lesser degrees of stress, more subtle, that air pollution has a tremendous impact on cancer patients. And I will pause there. And does that answer the question?
Yes, Dr. Ken, thank you so much for your valuable insights. Coming to Dr. Nandini, I hope you can hear me, right?
Yes, I can hear you.
Ma'am, since this program is live, I would request you to kindly turn on your camera while you are speaking.
Yeah. 1 second, Suchitra.
No problem. Thank you so much. Yeah. So, Dr. Nandini, beyond smoking, how strong is the evidence linking air pollution and climate change related factors to lung cancer?
Okay, so basically, which was just discussed by the previous speakers, that we all know that air pollution has and climate change has significant impact on health, just not in terms of cancer, with respiratory disease, with cardiovascular mortality, and we also know that it impacted cancer in multiple ways, and it was just discussed about myeloma and other tumors. In 2022, a group from the UK led by Dr. Charles Swanton, they mechanistically proved that how would you get cancer based through air pollution. It was, I mean, initially we know it's like a theoretical concept, but nobody could put it into exact scientific mechanisms. So what he did was he looked at three things. One is what we consider biologically, how does cancer develop. So he looked at whether it is just carcinogenic, just having multiple mutations, like what we see in smokers with lung cancer. They smoke irritates the lungs, it causes lots of mutations, and that leads to tumor mutation. It may not necessarily be. The other thing he looked at is whether that pollution is leading to subtle changes and it is promoting an environment which might cause cancer, and that is what he proved, and it was first presented at the ESMO in 2022, and then it has been published. And after that, there's a lot of work that has come from that group on all these things. So what he basically showed was that patients who so there are two things he looked at. One is there any kind of predisposition for lung cancer with polluted areas, and that we all know that in lower middle income countries, Asia, Africa, the incidence of lung cancer is pretty high, especially the incidence in non-smokers is pretty high, which is very different from the Western population. So he proved that, I mean, with there's data for that. And then he looked at what is a biological mechanism. So what he did was he saw that in mouse models, if you put something that is discussed previously, PM 2.5. If you through the endotracheal tube, you give it to the mice, and then they studied the mouse lung and they looked at how those mice developed tumors. And what they saw was that the pollution causes some kind of inflammation, and it causes release of chemicals called interleukin beta and other things that basically influence the two things. One is it influences the lung cells to have those which have those mutations because of aging or whatever, like EGFR or KRAS. Those cells grow in number, so they get selected. And also the normal lung cells, they kind of go back to their stem cell like state and they become more proliferative. So that is how those cells then tend to grow fast. So when we know in our body we have some cells which are progenitor, they keep on regenerating, and some of them develop and remain in their developed state. So it also enhances those progenitor type of cells, the normal lung 82 type of cells in the lung, pneumocytes, what you see, to become more active. So he proved that. So with that, then we had a better understanding. We could put a finger on exactly what is the mechanism, and it showed that pollution promotes environment and promotes the growth of cells with genes that lead to lung cancer. So that is how it is promoted, and it correlates with what we as Indian population we see in our patients and amongst people who have lung cancer, who are living in lung cancer with India, is that we have lots of patients who have no exposure or environmental exposure, or including for that matter biomass exposure. We know that in India now all the biomass and biofuel is getting replaced by LPG. The government has subsidies, so everybody is not using firewood or things for cooking anymore, but still you see a high incidence of lung cancer, especially amongst women, including rural areas, where in some areas where you would not expect to have that much of air pollution, but it is there. So there are factors that has linked it. So that is one thing. The only thing is now we are not able to accurately basically quantify who has got what exposure, because of course you may not be aware of the PM 2.5 index. You may not have AQI measured in all parts. Maybe metros, because of the hype and the extreme levels of pollution, have AQIs measured, but not every town or small village will have somebody who's going to measure the air quality index and quantify the risk. So these are the problems that basically happens. And I mean, there is a strong evidence now, both in the lab and lots of other research, that has shown that there is a link. They have identified what are the biological mechanisms, and probably in the future they may look at how to target these biologies to decrease progression or to screen patients. Maybe things will come up in the future, but this is how pollution is proven to cause lung cancer.
Yeah, thank you so much, Dr. Nandini. Moving on to Dr. Yannick. So, Dr. Yannick, as somebody who focuses on highlighting tobacco as a risk factor for lung cancer, what is that one message that you would like to give out to the people listening to this webinar? And also kindly tell us about passive smoking as a risk factor of lung cancer.
Thank you. Thank you very much. It's a pleasure today to attend this important meeting and discussion as we mark World Cancer Day. As you can see, I have duty today, and thanks a lot. There is one, the single most message that I'd like to tell today is really tobacco remains the single most preventable cause of lung cancer. The report from WHO that was issued yesterday actually says 67% of lung cancer cases are due to smoking. And we know that we've just heard from Nandini about the carcinogens that are present in hair, but also tobacco. We know tobacco, there are around 70 carcinogens that are chemicals, harmful chemicals, so that trigger cancer and lung cancer specifically. So tobacco is still driving an enormous and huge human cost. So we continue to see over 8 million people deaths, 8 million deaths every year from direct tobacco use. We also have 1.2 million of these deaths that occur among people do not even smoke. I'm not talking about air pollution, but these are the people that are exposed to tobacco smoke. And we should remind that it's not only a personal health risk, so people that are smoking cigarettes, but also it affects the whole society, the families, the workplaces, every community. So second-hand smoke contains the same toxic chemicals and carcinogens that direct smoking. And we have to remind that to everyone, even if it's like easy to recall, and we know it's since years. So for non-smokers, the exposure significantly increased the risk of lung cancer and other illnesses. So this is why we at UICC advocate for smoke-free environment. So it will avoid the exposure to second-hand smoke. It will prevent ex-smokers relapses, because when they are in an environment where you are allowed to smoke, they relapse and they continue smoking, but also the normalization of tobacco use among the other communities. When you look at people that are, for instance, smoking around kids' playground, you normalize the fact that they smoke. So they are exposed to second-hand smoke, but also to the imagery of tobacco consumption. We also need to counter the tobacco industry narrative and report any interference in alignment with the WHO FCTC. So really, I'd like the audience to keep in mind that the normalization, and thank you, Ken, normalization, we forgot about it. There are series, there are movies back in the 80s that were showing people smoking, but now it's back. Look at your favorite streaming channels and so on. People are smoking a lot. So there is normalization behind it. So, and what we also know, and we must emphasize, is that quitting saves lives. So we have to support also smokers to quit and stop the stigma around lung cancer and lung cancer patients, because there's a lot of stigmatization of lung cancer patients, because we always think that they were ex-smokers and they were triggering their own disease and so on. So I think that we have to keep that in mind in terms of passive smoking, normalization of tobacco use, and doing whatever we can to support smokers and lung cancer patients to quit. Thanks a lot.
Thank you so much, Dr. Yannick. My next question will be for Dr. Rishabh. So, Dr. Rishabh, from a clinician's perspective, are we seeing changes in lung cancer presentation or age of diagnosis, and which you think is directly linked to air pollution?
Yeah, so same thing has been alluded by previous speakers also. We see younger population, non-smokers, there is gender disparity, more females coming in our clinics, who are presenting most likely due to air pollution being the risk factor in their cases. So it is surely a matter of concern, and that transition also, if we see the quantum of patients coming is also increasing. So younger patients, non-smoker patients, and it has a lot of implication, because someone who is say between 25 to 50, two generation depends on them. So they are supporting either their parents or supporting the kids, and they are the most productive population in the society. And the second problem which we see is, because they are non-smokers, they are diagnosed late. They are not, so even if they go to physician, they are not being suspected of lung cancer and not worked up in that way as we do in someone who has smoked 15 years, 20 years, 25 years. So they are picked up late also. So surely there is age disparity, gender disparity. Also, we see more of adenocarcinoma than squamous or small cell carcinoma in non-smokers. And just because we are picking it up late, a lot of them are in advanced stages. So these are the differences which we see clinically, and most of this can be attributed to air pollution.
Thank you so much, Dr. Rishabh. And next, coming to the caregiver's perspective, Dr. Tanya, what is that one challenge caregivers face that you feel is not adequately recognized when we talk about lung cancer and environmental risk?
Okay. Hi, Suchishmita, and greetings to one and all present here. I am thankful that I am a part of this panel. So, from caregivers' point, what I feel needs a little more attention is the why factor. The first thing when you tell the patient or the patient learns he or she has cancer is why me? Why did I get the cancer? So, as clinicians, obviously the focus goes on how it happened, what can we do now next, but the why factor is still not addressed adequately, I feel. And this leads to feelings of guilt and helplessness. And patients and families they often grapple with what ifs and self blame, which can complicate grief and coping as well. So this is one issue that needs to be compassionately addressed, and it just brings about unwarranted guilt. And speaking of environmental risks, as our speakers have spoken, I myself and my family, there is a patient who's diagnosed with non-smokers lung cancer. The first question when she had is, why did it happen with me? So recognition or identification of certain pollutants or certain carcinogens, and what is the degree of the exposure. So there's still the quantification and the research of how much exposure can lead to which type of which category or which type. So still we need to get to that point where we can tell that if you do this it can cause this, if you are exposed to this it can cause this. And I would rightfully like to quote from a book which is Charak Samhita. Acharya Charak is known to be the father of medicine. So there in the section on specific features of transportation and transformation, in the third chapter, it is said that Vayu Udakam Desham Kalam. There are four factors which affect human beings in common. Vayu, as we've been talking, is the air. Udakam, water to certain extent. Desh means the place where you were staying. And then Kalam, the time in which we are staying. Say, suppose, for example, how things or the environment or, it was 10 to 20 years from now is also a factor which is not in our control. We can't control these four things. We can take medicines which have been prescribed to us. We can follow the do's and don'ts, the diet and all, but we cannot. It's not possible for everybody to relocate to a environment which tackles all these three. So this what ifs factor or how the etiology, I feel it needs more addressing, and because unnecessarily I'll just it causes stigma. Just one example I'd like to quote from what I have seen in my mother is, like in the month of December, within a gap of 15 days, another two of my family members, they got diagnosed with cancer, but it was renal cell and clear renal cell carcinoma and breast cancer. So the stigma that was in my mother's mind was, when she's diagnosed with the mesothelioma, pleural mesothelioma, she was like, did I give them cancer? So the patients don't know, like, what should they be doing, and this needs to be, I think, addressed on a larger scale. Thank you.
Yeah. Thank you so much, Dr. Tanya. Thank you so much, everybody, for your insightful views. Coming back to you, Dr. Urvashi. So, as someone who has been a part of Niti Aayog and who is also a strong patient voice in India, what is that one message regarding air pollution that you would like to give out to the policymakers in India?
Yeah, I would just say that, it's not just a health issue, it's an economic issue. It's an issue of allowing young people to be able to contribute fully to the economy, to the society. In India, we talk a lot about how majority or a large share of our population are young people, and that constitutes our demographic dividend. But now we see that young children are on nebulizers, and they are getting all kinds of serious lung issues. So is that what we want to do with our children, with our young people? How are we going to reap the benefits of this demographic dividend if this is what keeps happening? And again, like it's been discussed as well, that lung cancer is one impact of this air pollution, but there are so many other, kind of impacts that it is having. And for everybody, the impact might not be seen today, but certainly in a year, 2 years, 5 years, 10 years from now, a lot of us who are living in this kind of heightened air pollution. And frankly, most of India now is actually the, if you look at the AQI data from across the year, because initially we thought it's only, predominantly North India problem. Then we thought it's predominantly a winter problem. But now, as people are analyzing more of the AQI data from across the year, it's pretty clear that, we have poor air quality at many points in the year. It's not just a short winter phenomenon, and it's certainly not just a North India phenomenon. I'm coming from Mumbai, which is on the sea. And normally, because of the sea breeze, we've never had air quality issues to that extent there. But now, even there, 200, 250 AQI is very normal to see. So this has become an issue for large parts of India. I think there was some data to say about 60% of Indian districts. If you look at their AQI through the year, it is not a great picture. So I think this is something that is affecting everybody. Like I said, air is possibly the most fundamental thing. We all need good quality air that we can breathe, and policymakers need to address this. Like I said, of course, from a health point of view, from a public health point of view, and that should be enough of a reason, frankly, to invest in it. But if they need more reasons, then I think it's also an economic issue. There are people moving out of Delhi, they are moving out of cities, but frankly, you don't know where to go anymore. There's very few places, in the country where you can be very rest assured that you'll have great quality air through the year. So, yeah, I think it's a public health issue, it's an economic issue, and I think for that reason, policymakers at both the central and the state levels really cannot afford to ignore this, and they need to really put in resources. It's already long overdue, but I think if we delay it any further, then we risk paying an even heavier price.
Yeah, thank you so much, Dr. Urvashi. As you mentioned about the AQI, so coming to Dr. Akhil. So, Dr. Akhil, can improving air quality realistically reduce lung cancer incidence, and how quick might we see the impact?
Definitely, presently, what we see in the entire Southeast Asia, not only in India, lung cancer, especially non-smoking lung cancer, is on the rise. For that, many things are responsible, and pollution is one of them. Apart from pollution, we are seeing some genetic cancers on the rise, which we never thought that lung cancer would have some components of genetics in it. Yes, it seems that pollution reduction is important, and at least 5 to 10% of present lung cancers, especially in young lung cancers, are caused due to pollution. That is the rough estimate which is there. It cannot be accurate estimate. It can always vary from place to place. And if we reduce pollution today, it is expected to bring a change in the incidence of cancer over a period of 5 to 10 years at least. It doesn't immediately cause cancer. It is accumulation of the toxicity and accumulation of the hits which are there, which cause changes in the genome and leads to development of new mutations causing lung cancer. So, if we want to think about improving incidence and reducing the incidence of lung cancer, especially the pollution driven lung cancers, we need to work it now. So if we work it now, in the next 5 years, we will see the impact in the next 10 to 15 years. So it's not a one day procedure. We need to be very rapid in that. And what we are seeing, the alarming increase in pollution today, it is yet to be translated into cancer. So what we have seen then in last 2 to 3 years, the pollution is toxic control. So we need to understand that we are yet to see the worst part in next few years. So we need to be very fast aware, and our um, the pollution control boards need to be on the board very rapidly. Otherwise, we will see much poor option. Thank you.
Yeah, thank you so much, Dr. Akhil. Coming back to you, Dr. Ken. So, Dr. Ken, what measures, in your opinion, can be taken to reduce the effect of climate change and its direct risk on rising cancer cases across the world? And also, following that, are there any specific policy reforms currently being undertaken in the USA?
Yeah. I struggled with this question. I will confess that if you had asked me this 18 months ago, it would have been a much easier task to address. I think, as has been alluded to by many other speakers, problem of air pollution and climate change is intimately uh, and mixed up with the question of politics and greed. And I think one of the biggest struggles we're seeing now is that there are there's a lot of corporate money that they view as being at risk if we take common sense steps to address climate change. You know, the technology is there. It's the political will that is lacking in many countries. The problem is that it's the rich nations are doing the vast bulk of the polluting, and the lesser developed nations are not doing the polluting, but are suffering the fallout. No pun intended of all of that. What is going on in the United States? I'll take the second question first on the first, and then the first. What is going on in the United States, I think, is there are people trying to transition from our democratic model of government to a more authoritarian model. The good news is that I believe that will ultimately fail. The long arc of history, I think, as Dr. Martin Luther King said, bends towards justice, and I have to believe that that will hold true. The other bit of good news is that, having burned down much of the American structure, it has to be rebuilt, and the rebuilding process can build something better. So I think that's the bit of good news. That becomes relevant because what you see now is, in the past, the non-aligned countries had a choice between authoritarianism and not non-authoritarianism, authoritarianism in some way. That choice is less clear now, and so I think the path that needs to be taken forward is that the smaller countries, the less affluent countries, need to be able to stand on their own 2 feet and work together to find a way forward without the United States, without China, without Russia, because it's only by having a true choice between climate change activism and action, and actions that are intended to benefit the money rich classes, that we will find a way forward. And I don't mean to sound like this is a political screed. I just think it's a realism. So thank you.
Thank you so much, Dr. Ken. Now we come to Dr. Rishabh once more. So, Dr. Rishabh, are there any specific age groups that are more vulnerable to climate-related lung cancer risks? And if yes, then why so?
Yeah, so I think younger the age group, they have more chances of prolonged exposure. So right from children to adolescent, I think that age group is very susceptible because day by day, at least in our country, we are seeing that air quality is deteriorating, and also the impact of climate change is visible. Also, there is some biological basis like younger, especially children's, they would have uh, higher respiratory rate, they would absorb more pollutants when they breathe. So the chances or the impact would be highest in younger population. Nonetheless, the risk continues even in middle age and elderly population because they are at higher risk of mutations, the elderly population. And middle aged population, even if they smoke, they are not smoking much or they are smoking less, but air pollutant pollution and climate change, they would add on to the risk factors. So cumulatively this will impact all the age group, but the most affected would be children and adolescent population.
Yeah, thank you so much, Dr. Rishabh. Um, okay, before like only have like two more questions, but I request all the speakers to kindly be in the, in the panel so that we can click one picture. And yeah, so coming to you, Dr. Yannick. So, Dr. Yannick, together all of us are here raising awareness on climate change being a risk factor for rising cancer cases across the world. So, what can organizations like UICC and Lung Connect India Foundation do to put across this message to the policymakers?
Thank you. Thank you for the question. Well, we just saw that air pollution, indoor, outdoor, is a major risk factor for lung cancer alongside tobacco. So again, the report issued yesterday from IARC said that 19% of lung cancer cases are due to air pollution. So I need to dig a bit on that report that was just issued, but this is what we had. So it really contributes to significant proportion of global cases. And I think it's information that so how do we act on this actually? So organizations like UICC at the global level, Lung Connect India regionally, but also internationally, how can we have a powerful role in shaping those policies? So first, as I said, we had a report yesterday from WHO. There is all the researchers that are producing evidence. So evidence-based advocacy, which is grounded in different programs, not only UICC, but all members, all cancer organizations, and so on, all foundations like yours. So using first evidence-based advocacy. So we have the evidence, we have the numbers, we have to use it to integrate those programs and so on. We have to communicate strategically during major global health moments. I mean that the World Health Assembly last year, we had the lung health resolution, including lung cancer. So we have to use those platforms. I'm thinking about our own World Cancer Congress that we organize every 2 years. By the way, next year we'll be in Southeast Asia, we'll be in Hong Kong. So using those platforms, also key awareness days. So those platforms like the Lung Cancer Awareness Day, Lung Cancer Awareness Month, Environmental Day, I think it's in June, those platforms to raise awareness among the different stakeholders, the policymakers, the general public, and so on. We have to frame also climate and air quality policies as essential cancer prevention tools. So which means that we have to integrate those policies that exist, they exist outside, what we have to combine and to have them complementary to cancer prevention interventions. We can produce joint policy briefs for the policymakers. We do that regularly for other topics, for other cancers and so on, and having unified and harmonized advocacy messages between the different organizations. We have to highlight, and I've heard that several times today, the inequity or equity issues with the different communities. We've heard about urban communities or low-income groups that were more affected by air pollution or by tobacco use and smoking. So we've done last year a study on all the national cancer control plans that exist in the world. And we looked at two different things. First, how lung cancer was addressed. Lung cancer screening mainly was addressed in those national cancer control plans. Only 12% of national cancer control plans were mentioning lung cancer. When you compare to other cancers, cervical or breast, it's 90%, 90% compared to 12%. So there's a gap. Second, how do you include the patient voices? Only 18% of the cancer plans involved patients with lived experience in either the development or the implementation of a cancer plan. So you have to increase that to really integrate those voices into the cancer control strategies. So just to finish on that, we need strong evidence. We've heard that today, research and so on, strategic communication using all the platforms that we do, and having an harmonized advocacy messaging toward the different stakeholders. And thank you.
Thank you so much, Dr. Yannick. So coming to you now, Dr. Nandini. So Dr. Nandini, from an Indian perspective, like should environmental and climate exposure histories become a routine part of lung cancer risk assessment, considering that many of our cities in India are now the most polluted ones in the world?
So definitely, taking history of environmental exposure is important in lung cancer. It is, I mean, that is what we also do. But the question is, how do you quantify exposure to environmental pollutants, and which are the pollutants that you do it? In our country, it's very difficult, and especially in centers like ours, which are referral centers where people come from 2 to 3,000 kilometers away. It's little difficult for us to exactly put a finger on what is the AQI at that place. Of course, with smoking, you have smoking indexes, you can count the pack years, you know how much the patient has, you can objectively quantify the risk of exposure. But just like it has been discussed previously, passive smoking or secondhand smoke exposure, also pollution, environmental pollution is a little difficult to assess. It is very important to take this history. Definitely, there is no doubt about it. Also, occupational history for patients who do work, like people who are exposed to traffic police, people working in industries. So there are a lot of laws in India which look at uh, protections for workers. It is like your to asbestos exposure, to other heavy metal exposures and things like that. But ultimately, if we don't really know how many of them do really use protective equipment at the ground level, you can, for example, if those who live in Mumbai can look at our traffic police who are, I mean, on the streets every day, they all use some kind of mask. During COVID, the mask uses were much higher. And even those routine people on the street who are guiding traffic or volunteers also are exposed to pollution. So how do we quantify that in terms of the hours of exposure, the area of exposure, the AQI? What are the other, like nitrous oxide, sulfur oxide, non-particulate matter exposure, other carcinogens? We don't are not able to do it objectively. It is extremely important. We try to get this history, but sometimes it is not possible to get this history. So considering in all settings, I think environmental exposure, especially for lung, is vital. It is essential to get this history, but very often you will find that there's a lot of variability in reporting by the patient, or patients may not even think that these XYZ factors are actually considered as a potential carcinogen or a trigger for cancer. And so they would never tell us, and we would never understand that these are the potential. So what you read in a book, or technically what we read in the scientific papers, are one thing, but then those patients should, I mean, for us to put it across to the patient that, okay, these are the factors. Are you experiencing this? You usually ask smoking, they say we don't smoke. So it's a like straightforward yes or no. But when you probe, you probably ask them, what do you cook? How do you live? Are there anything? Do you use firewood? Which place do you stay? What kind of job do you do? And then slowly you realize that if you take a detailed history, you might actually be able to identify the carcinogen or the exposure that patients have through occupational diseases and environment. So it's a little difficult to quantify, but it's something very important that we need to elicit.
Yeah. Thank you so much, Dr. Nandini. Before we close for the day, Dr. Tanya, do you have any last comments?
Yeah, so I was just listening to all the speakers, and when we are talking about environmental risks, we've been continuously talking about pollution, and while we are talking about pollution, we cannot help but just talk about global warming, and clearly, global warming is the greatest threat to global health. Now, the responsibility it lies on various shoulders, of course, government and the policymakers, then industry, especially communities, us as individuals, and there has to be stricter policies, be it stricter immersion policies, or be it promoting the clean energy, being it the public transport, waste management, green spaces, etc. We cannot. I mean, there are a lot of other we can just simply keep on talking about these points, but eventually I was just going through the comments, so somebody mentioned that the 7-11 attacks was also, like, like Dr. Nandini also said, that we need to ask this question apart from whether there's a smoking history or not, environmental risks. So it brought me to another thing, like especially patients who are somewhere between maybe 65 to maybe 80 years old, there could be a potential, if they were not exposed to factors which we can commonly pick, it could be something which was like a historical war or something, so they got exposed to certain explosives. That could be one of the probable cause. I mean, we need to thoroughly question them. So eventually, yes, a lot needs to be done on this.
Yeah, thank you so much, Dr. Tanya. So, like, as we close for the day, on behalf of Lung Connect India Foundation, I thank our panelists for their valuable insights, and also each one working towards the future where nobody develops cancer simply because of the air they breathe. So today, let this conversation not end here. Let it inform action, advocacy, and accountability. Thank you so much, everybody, and wishing everyone